You are watching McLaren Port Huron Today's Health, and today I'm speaking with fellowship-trained orthopedic spine surgeon Ryan Goodman about conditions that affect the neck, and in this segment we're talking about neck instability. So Dr. Goodman, thanks for joining us.
Oh, thank you again.
Dr. Goodman, what conditions are known to cause neck instability?
Neck instability can be caused by several different conditions. One of the most common is actually trauma. Trauma to the cervical spine due to the fact that it's very mobile, vulnerable, and the bones are a little bit smaller, can cause instability within the spine. Specifically in the elderly population, fractures within the cervical spine are fairly common. Some other things that can cause instability in the cervical spine are just degeneration over time. Arthritis causes the cervical spine to be more vulnerable as well to some instability. Specifically, instability is called spondylolisthesis, or the slippage forward of one vertebrae on the other. When this happens, it causes what we talked about before, stenosis. It causes pinching of the nerves within the cervical spine at very specific levels, wherever that slippage has occurred. Similarly, in trauma, if there is instability within the bones due to the fracture or because of trauma, this can also cause similar symptoms of stenosis, like we talked about before.
So refresh us, what are those symptoms that someone with instability would have?
So some of the symptoms with instability are they feel unstable. That is very common complaint among patients, that they feel a sense of instability within their neck. Obviously, patients who experience trauma within their neck have a lot of neck pain, and unrelenting neck pain that just doesn't seem to go away with any modality of treatment. Stenosis in the cervical spine can cause radicular pain, or pain that goes down the arms and into the hands. It can cause numbness and tingling within the arms or hands. And more severely, or when it becomes more severe, a patient can get something called myelopathy, like we talked about before. Myelopathy is difficulty with fine motor skills, difficulty with walking and having unbalance when you're walking. And having fairly severe upper extremity numbness and tingling.
So how do you diagnose this condition?
We always start with a very thorough history and physical exam, and if I feel that it's necessary, we will get advanced imaging in the form of either MRI or CT scan, or sometimes both. We will take x-rays, usually in the office, which are dynamic in that we can watch the patient's motion through flexion and extension to see how their cervical spine is moving. If it happens to show that there's instability or more motion than is acceptable, then we have to explore treatment options for this patient.
So are there some non-surgical treatment options that you would recommend?
Definitely. We can always explore non-surgical options such as physical therapy, muscle balancing, medications, or injections to decrease inflammation around the nerves.
And at what point do you think, do you tell patients this is when you need to come back and see me, we need to talk about the next step?
Definitely. When all those modalities don't work, if they continue to have pain, if they continue to have this sense of instability or problems with their neck, arms, difficulty with the fine motor skills, then they definitely need to come back, and then we would talk about surgical options once all of those things have failed.
So can you give us an overview of the surgery and what that all entails?
Sure. In patients who have instability, surgery that we do for them is to stabilize it, and this is a fusion surgery. We have a model here to demonstrate. This is a view of the cervical spine, kind of like we saw before. This is the front of the cervical spine. This is the back of the cervical spine. This is the top, and this is the bottom. Usually what we will do is we will come in through the front of the cervical spine to the front of the cervical spine through the neck, and we will take out the problem discs that the patient has, either from disc herniation, from degeneration, or even in a traumatic event. We will then replace these discs with spacers, which have bone graft in them. We will then stabilize that whole construct after decompressing the nerves very thoroughly with a plate and screws. This locks everything into place and makes it stable so that there is no more instability that can happen at this level. We then wait, because over time the bones will then fuse together or grow together.
And what would be like the anticipated recovery, or how long would a patient be in the hospital?
Sure. Usually about 3 days, 3 weeks, or 3 months is my motto. 3 days after surgery, a patient feels like they had surgery, you're recovering. Usually for these types of surgeries, a patient will stay about 1 day in the hospital, maybe 2, depending on how they're doing. After about 3 weeks, their soft tissues are healed and they're back to a little bit more normal life. And after 3 months is when the bone is usually completely healed and they can get back to the things that they love to do.
Very good. Are there anything that you would tell someone that's like experiencing neck pain? When should they come and see you?
I always say, if you're having pain, don't wait. I'm always here, and you can come and see us, and we can evaluate you. If it starts conservatively, then we start conservatively. If we need to move on to more invasive procedures, then we will. But we're here for you no matter what. So
great. Well, this has been great information, but we do need to take a short break.
Sure.
So please stay with us. We will continue this discussion with Dr. Goodmanson when we return.